That you got that?
I think so.
Alright. Basically, let's talk about the differences in the types of burns. Okay? First degree, sunburn. Basically, that might just be a heat, a scald, hot liquid. Okay? Just as an FYI, for those of you that take care of patients that have those thickened liquids, if you've ever seen that nasty coffee that they send up, it will stick to your skin and burn the fire out of it. Okay, so be very, very careful with your patients with that thickened coffee. It's basically just like tar. Okay? And I have seen second degree burns from you. So, second degree burn is basically a partial thickness burn. It's also termed what? What do you see where the damage is?
Blisters.
You see blisters, fluid-filled blisters. Do we pop them?
No.
You want to, but you don't. Because typically what will happen is that skin will slough off anyway. Okay? If you start seeing those blisters, one of the nursing interventions that you're going to start doing is what?
Pulling.
Elevate that extremity, okay? Why do we want to elevate that extremity when that edema starts forming? To decrease the edema, because what can occur with a burn injury? Compartment syndrome. Okay? Alright, what about third degree? They're termed full thickness burns.
Pearly white.
Pearly white, leathery, eschar. Okay? Typically, these are going to have surgical intervention with that eschar. They will do an escharotomy, taking that off in about 3 to 5 days after the burn. Remember, he said that they usually don't do that immediately. They wait for the burn to declare itself a little bit. Okay, fourth degree goes all the way to the bone. Okay, typically treatment is what? Amputation. Okay. Alright, rule of nines. Alright, so when you're talking about the little picture that he's got, you see the 9 for an arm. Okay, remember that includes the front and the back. If you're only talking about a burn on the front, that's 4.5. The back is 4.5. Same with the legs. 9 on the front, 9 on the back. If you get a calculation to figure out burns, I will give you a picture.
Cool. Thank you.
From the wrist to the elbow is 4.5, and then from the elbow to the shoulder is 4.5.
That's what he said.
But it's still
It's still the front. Because if you add it up, it's more than 9 per arm.
Can't be more than 9 an arm. Okay, he may have said that, but if you look at the picture I'll give you, you'll figure it out. Okay. London Brower, he said it was the most accurate. Look at what you will see on that age range. Okay, you're talking about 0 to 1, 1 to 4, and then 1 to 2. What is that? I can't see. 5 to 9, 10 to 15. So when do you think London Brower is most often used?
The pigs.
Pediatrics. Okay. Primary survey, secondary survey, we're going to talk about that a little bit more next week, so I'm going to skip over that. why is it important to figure out if these people have had inhalation injuries or not? Airway management, okay? So that if you've got someone that has an inhalation injury, either with soot from the smoke or inhalation injury from like steam or hot liquid, then that is one of the things that you're going to want to make sure that you have your airway protected, and the best way to do that is intubate them. Okay? All right. What do we worry about with carbon monoxide? Odorless, tasteless, colorless. Their level of consciousness. What did he say that most people think they've got? Okay. Be clued with that. Okay. Is that they feel like crap when they're at home. When the furnace is acting up. They come to work, they feel better. They go back home, they feel bad again. Okay? Remember, when they get out of that environment, they're able to clear that carbon monoxide from their system. Looking at the levels. If you've got 10 to 15, you're asymptomatic. 15 to 40, you have altered level of consciousness, which might mean what? Tired. Confused. Lethargic or sleepy. Okay, 40 to 60 is CNS dysfunction. What am I talking about there, guys? No, CNS, central nervous system. You may have some problems with heart rhythm. They may be comatose. They may have problems with weakness. Now, if it gets deep enough, then yeah, it's going to hit that vagal nerve, and then you're going to have heart rhythm problems. Okay? So think about those carboxyhemoglobin levels. Can you check it with an O2 sat?
No.
Okay.
A special one.
Special one. Very good. All right. Burn shock, hypovolemic shock. What's the best way to treat it? Fluid resuscitation with what fluid?
Lactated
Lactated ringers. Very good. So, how are we going to measure how much fluid we're going to give? What's the formula?
2 liters times body weight times percentage.
2 milliliters fluid times body weight times percentage of burn. Okay, that's what? Is that the total in 24 hours? Yes. So then what do we do after that?
The first half of it.
Half of it, first 8 hours.
You take it and split it by half. Okay? So, say for example, we have a patient that weighs, we'll make it easy, weighs 10 kilos times, we'll say 30% body weight. Those of you that have math brains, figure that out. 600? Okay. So what do we do? How much am I going to give them the first aid? 300. Okay. Well, the burn happened at 8 this morning, and they didn't get to the hospital until 11.
So you're giving it 300. You got to give it in 5 hours.
So I have to give this in 5 hours. So how fast am I going to have to give it? 60 an hour. Remember, it's the 8 hours starts from the time of the burn, not the time they hit the hospital. Okay? From the time of the burn. And remember, that's something that hopefully hopefully will be taken care of at your little feeder hospital, okay? But it may be that they're in transit, okay? All right. How do I assess for compartment syndrome?
5 PEDs.
Actually 6, but that's okay.
Pain, paresthesia, paralysis.
What's going to show up first?
Pain.
I think pain.
Maybe the pulse.
Basically, what you're going to see is that you're going to see that numbness and tingling first. Okay? It's just like when your leg goes to sleep. Basically, what that is that you've compressed your blood vessel and it's not getting enough oxygen to those tissues. You get that pain, that numbness and tingling first, and then when you try to stand on it, you get pain, right? Okay? So you'll see numbness, tingling. You may see pain. Usually, what do you see last? The paralysis. Okay? Typically, if it gets to the paralysis state, there may be permanent damage done. Alright, so think about nutrition for these guys. We're going to give them what kind of diet? High calorie, high protein. Okay? How many calories did you say a day? Up to 9,000. Okay, anyone ever tried to give that much tube feeding? Okay, I'm going to tell you, if you look at your high calorie of those tube feedings, okay, the most that you're going to be able to get out of those is 1.5 calorie per ml. Okay? So if you're given 9,000 calories by tube feeding at 1.5 ml, we're talking a ton of tube feeding that you're trying to get in. Okay? And I'm going to tell you, what's going to happen is when that high calories hit the gut, it's going to come out the other end very quickly. And you're going to have code brown all around. Because those high calorie tube feedings like that are very, very difficult to maintain. And it makes no sense, but typically what you have to do is you give them Metamucil. Alright, typically we give Metamucil to do what? Help you poop, okay? With these patients we give Metamucil to hold some of that stuff together, to give it a little fiber, okay? Just as an FYI, we had this guy, 22 years old, motorcycle accident, horrendous head injury. Basically, the guy was probably 6 foot tall, maybe weighed 140 pounds, soaking wet. Okay? He had something that we called hypothalamic storms, where he would elevate his heart rate, blood pressure. I mean, his blood pressure would be nothing to go to 220 over 120. Heart rate 180. Respiratory rate 32. And his temp would go to like 105 because he had damage to the hypothalamus, where all of those things are regulated. We calculated for this 140-pound guy to maintain his body weight, he needed 15,000 calories a day. No way we could do it. We got as much in him as possible, but what we hope to do is to decrease the amount of these episodes that he was having. Then he only needed 8,000 calories a day. But I'm going to tell you, those high calorie, high tube feedings, you're going to have difficulty keeping it in on them. So just be aware of that. Metamucil does help. Okay. What electrolytes are we really worried about with these people? Potassium, because of what? Breakdown of the cell walls. Alright, so, wound management. Basically, one of the things when you're talking about, what did he say about genital wounds or genital burns? Exfoliate them as quickly as you can. Okay? And it may take a urologist to do that, I want to tell you. Cutaneous injuries like high voltage. Typically what you'll see is that AC current can cause some of the worst damage. DC current, usually what happens is they're blown away from the source of the injury. Commonly what you're going to see with electrical injuries is that defib or asystole are going to be your cardiac rhythm, because what you're going to see is that very large amount of current hitting them. Okay. Just as an FYI, North Carolina is second in the nation in lightning strike deaths. I don't know if it's because we don't know enough to get out of the rain, or the number of golf courses and agricultural things in the state. Florida's number 1, North Carolina's number 2. If you were to come along someone that has been struck by lightning, or there's the side flash, typically what you need to do is treat the one that is unresponsive first. The people that are sort of dazed and out of there, usually they're going to be okay, because they don't typically go into VFib afterwards. Okay? They usually are okay. Fertilizers, petroleum distillates, all of those. Remember, what we're going to do is brush off the dry and rinse the wet, trying to get it off. Water is pretty much the universal antidote for everything. Frostbite, how are we going to take care of that?
Slowly
Rewarm gradually. What water temperature should be?
100 to 110.
About 105, 110. Okay. Remember, that is much less than your hot water that comes out of your kitchen sink. Most water heaters are set between 120 to 140. Okay, were there any questions about burns other than what I just went over? I did post that video on the spray-on skin gun. Again, sulfamylon, you have to be careful about patients that are allergic to sulfa drugs. Remember, he said that they take the permanent skin grafts from the patient's own skin. Okay? And that little cheese plane looking thing. So, alright.